as carers struggle with the cost of living crisis. Research by the GMB Union also found 1 in 10 care workers have used a food bank in the last year. This news comes as the Archbishops of York and Canterbury call for a radical redesign of the social care system.
We're going to be speaking to the Archbishop of York and the care home industry boss, Jane Townsend, in a moment. But first of all, let's hear from care worker Samantha Spencer.
There is times where I've searched for a different job because it's like, obviously I love care, it's all I know and I absolutely love it with all my heart. But then there's times where you got to think, I need to do better. I need to go into a different profession to better my kids' upbringing. Our jobs is just as important as the NHS staff, if not more, because obviously we're there for the people's last days. We're the only ones they have, some of them, in the last days, where they're holding their hand when they take their last breath.
Well, the Archbishop of York, Stephen Cottrell, and Chief Executive of Homecare Association, Jane Townsend, join us now. Very good morning to both of you.
Morning.
I mean, for this to be tackled by the two most senior church figures in the country shows the scale of this crisis. You described the system as broken. We have been inundated this morning with care workers who say they feel undervalued, underpaid, stressed. What do you think we can do to fix the social care system?
Well, the report that we're launching today basically is addressing and asking for three things. First of all, a rethink about attitudes to social care. Very moving listening to Samantha. Yes. She's right. We need a system which is top to bottom, cradle to grave, care for everyone, but we need to rethink our part in that, and we need to start with the knowledge that every person is of value. Then we need what we're calling a national care covenant, which is a kind of agreement about what are my responsibilities, first of all, as somebody who will need care one day, almost certainly, but also somebody who gives care to others, but also what are the government's responsibilities, what are local communities' responsibilities, what are churches' responsibilities, and of course, ultimately, you know, I don't think it's actually a very radical thing to say. We need a new care system. We're lagging behind other nations. Social care is everybody's business. And so what we want is a big conversation to start from today, to take it out of party politics, out of election cycles, and to say, what kind of society do we want to live in? I think we want to live in a society where we care for each other, we value one another, where we value care workers like Samantha. Yeah. And they need a new deal, but in a way, the whole nation needs a new deal.
Jane Townsend, you are Chief Executive of the Homecare Association. How can we stop people feeling that they're undervalued other than paying them more? What do you think needs to be done?
Well, I agree with the Archbishops and the Commission's report that it's really important that we have a national conversation. Care is a basic human need. As a species, we can't survive without caring for each other. And if you look at our evolutionary history, even now, everything that develops comes through collaboration, empathy, connection. And that really needs to be recognised. And what we need to do is invest in the people that are delivering this really vital public service. And that's investing in their training, in their supervision, in their pay, in security of income, which is why, unfortunately, many of them feel driven to leave, but they don't want to. They love the work. You know, I speak to many care workers and they say, you know, I just love improving lives. In my previous role, I gave out 2 50-year service awards. I had one member of staff who was 84 and she was still going out every day on her bike, delivering care to the old people, she used to say. And so there are people who are very committed and we can see the impact of not having enough. You know, there are over 500,000 people waiting in the community for assessment and care. And then once they get into hospital, it's difficult to get them out again.
Yeah, because there aren't enough people to assess them and look after them. Archbishop, I mean, just give you some examples. Joanne has tweeted to us. In fact, this involves you, Ed. I worked in social care and had the pleasure of working with Ed. But Joanne left due to the stress of the job, not enough staff, and the fact she gets paid the same in a supermarket and doesn't have to do near enough 13-hour shifts So more time to spend at home. Tracy says, I worked in care for 6 years as a senior, left last year as I couldn't take any more. I was mardy, stressed, and always felt you couldn't do enough. I'm now back to my normal self, have my family back. Janine, I've been a carer in home care for more than 10 years. I get £10 an hour considering leaving because I can earn more working at a supermarket stacking shelves. I mean, we need these people.
Yeah, it's precisely because of those stories.
Would you say, Archbishop, sorry to interrupt, but this is about pay, isn't it?
Well,
this is about keeping people in care by paying them for the vital, critical work that they do.
Pay is absolutely, definitely part of it, but I think I would want to say it's only part of it. We need... The idea of a covenant is about recognising that all of us have a part to play, all of us have a responsibility to build a caring society, and of course part of that is the care system, and at the heart of that is the workers who deserve and need to be properly valued, both financially and in terms of their working conditions. But it's also about... I mean, I'm a carer, and there's hundreds and thousands of carers.
When you say you're a carer, do you mean because you care for a member of your family?
Yeah,
yes.
When my mum is ill, you know, I have a responsibility. And some people are full-time carers for members of their family. In fact, they don't even call themselves carers. I'm doing it for my mum. They need respite, and they need support. So this is building a whole system of care. That's what this covenant is about, which will change the whole way we approach this in our society.
And there is an important point here, which is about... it's not... I mean, so, of course it is about governments doing the right thing and willing the resources, but it's also about all of our attitudes.
Absolutely.
And there is a hangover here, isn't there, that, you know, that if you go back 100 years ago, we saw this kind of caring as something which happened in the home, was unpaid, and for whatever reason, our society has undervalued that care, and that is now an outdated attitude. And you're saying we need to modernise our view.
It's a rebalancing of view. So let me give you a very quick analogy. If it snows today, whose responsibility is it to deal with that? Well, I think it's the government's responsibility to grit the roads. But I think it's probably my responsibility to clear my drive. But what about the pavement outside the home? Well, we might need some negotiation about the pavement. Maybe community groups could be involved in helping to do that. What about my housebound neighbour? Who's going to clear their drive? We need a conversation about... We all have responsibilities to pay. Absolutely, government must play its part. Absolutely, there must be professional care, but I think I want to be in a society where I am encouraged to play my part as well.
Let me just ask you about another issue. I mean, what you're doing is hugely important, and building this consensus on care is really important. It is about kind of changing our attitudes as our world and our society, our values change. You, in the Church of England, have also been grappling with that issue around gay marriage and marriage in church. You very movingly talked at the weekend about being tearful about this change, which now means that you can do a blessing in church. There is, though, going to be a motion in Parliament today from MPs led by Ben Bradshaw saying that this should go further, there should be gay marriage. And, of course, the Archbishop of Canterbury, your co-author in the report, is saying that he won't be doing these blessings in church. Could you just explain to our viewers how you feel about this and why the Archbishop of Canterbury would not be choosing himself as the leader of the Church of England to take an action which you have now said is a modern view of gay marriage?
So first of all, both the Archbishop of Canterbury and I fully support what we're now proposing, which is that people who've entered into a same-sex marriage, people in a civil partnership, can come to church to have that marriage acknowledged. They can, as a couple, receive God's
And you will
blessing.
do those blessings yourself?
I will do those. The Archbishop of Canterbury fully supports that. He also has a role with the worldwide Anglican Communion. There is disagreement about this in the Church of England. There's a lot of disagreement across the worldwide church, and so I think he's stepping back from doing them himself for those reasons, but it doesn't mean he doesn't support what the church is doing. And although I know there's many people who wish the Church of England was going further, I just want to say I think we're taking a step forward, and I'm really pleased that gay people in committed, stable, faithful relationships can have that acknowledged in church.
What made you tearful?
Because I've got a lot of gay friends, and I believe the Christian faith, it's what this report is about. The Christian faith is for everyone. It's about a vision of living together as one people, and I want everybody to know that they're welcome and they have a place.
I wonder if the Archbishop of Canterbury is a little bit tearful that he can't...
I'm sure he is, yeah, but I understand why. But I am, you know, I look forward to being able to welcome gay people more fully into the church, even though I know it's not what everybody... Some people wish we're going
Attitudes
further.
can change.
They can.
And on social care too.
Yeah.
Yes.
Yeah.
Fascinating to talk to you both this morning.
Thank
Thank
you
you
very
very much indeed. Archbishop of York, Stephen Cottrell, and Jane Townsend from the Homecare Association. And thank you so much for getting in touch with us this morning. I mean, the comments just keep coming in. And the tragedy is that so many of you are saying you work in care, but you're thinking of leaving, or you've worked in care and you've left.
And you know, we can't say, please don't, because we all desperately want you to stay in care. But for that to happen, there's got to be proper pay and recognition and training and career progression. But also our society has got to say, we value you, and we don't say that loudly enough, and that's got to change.
We do say that on this programme.